Okay, guys, this is the last one for you. It's discussion C, discussing medications and cognitive um, performance. So here we go with tonight's discussion C. Now it's a long presentation, so bear with me, please, so I can get all the information to you guys. I hope it helps somebody with this situation or somebody who's maybe dealing with this with their loved one, being on medications and things. So here we go. Absolutely. Here are a few intriguing facts related to the topic medication and cognitive performance. Medications medications and brain function. Many common drugs influence cognitive function even if they aren't designed to target the brain. For instance, antihistamines used for allergies can cause drowsiness and sluggish thinking because they block histamine, which plays a role in wakefulness. Okay, then you have the cognitive footprint idea, similar to a carbon footprint. Researchers in the study introduced the concept of a cognitive footprint to measure the subtle effects medications have on thinking and memory at a societal level. Even small shifts in cognition, positive or negative, can add up. Okay, guys, next page. Give me a minute. Hold on. When millions of people take a medication over time, unsuspected cognitive boosts. Some medications may uh, in, in unintentionally improve cognitive performance. For example, certain drugs used for cardiovascular health, like statins, have been investigated for their potential role in reducing dementia risk. How widespread effect, how widespread effects matter. Even minor cognitive impairments from medication can have large scale consequences. If a drug affects memory or attention, it could impact workplace productivity, accident rates, or even long term brain health. Okay, medication can influence memory and attention in several ways, depending on their mechanisms of action and the. Hold on, I'll get next page. All right, two done. Okay. Neurotransmitters they affect. Here are some key ways they can impact cognitive function depending on neurotransmitter activity. Some medications, particularly those with uh, anticoagulant properties, interfere with uh, a cysteine a neurotransmitter crucial for memory and learning. Okay. Then there's a site you can get. Op- Oprah Opto Cures List. Prescription drug medications linked to dementia. This, this description can lead to cognitive impairment, especially in older adults. Sedation and drowsiness. Drugs like benzodiazepines used for anxiety and sleep disorders enhance the effect of GABA, a neurotransmitter that slows the brain activity. While this helps with relaxation, it can also impair memory, consolidation, and attention. Okay. All right. Next page. Impacting short-term versus long-term memory. Certain medications affect short-term memory, making it harder to focus and process information. Others interfere with long-term memory, disturbing the brain's ability to store and retrieve information over time. Increased risk of dementia. Long-term use of some medications, including proton pump inhibitors or PPIs for acid reflux, and certain antidepressants, has been linked to an elevated risk of dementia. Okay, then you get uh, prescription drug medications linked to dementia. Okay, histamine blockers and cognitive effects. First generation antihistamine, commonly used for allergies, can cross the blood brain barrier. Hold on. Hold on. Get this. And interfere with neurotransmitter activity, leading to drowsiness and reduced cognitive performance. Certain medications can negatively impact memory, particularly those that affect neurotransmitter activity in the brain. Here are some common types. Okay, anticoagulant drugs. These medications block acetylcholine, a neurotransmitter essential for memory and learning. Examples include antihistamine, tricycline, antidepressants, and bladder control medications. Okay, list of prescription drugs, medications linked to dementia. Okay, benzodiazepines used for anxiety and sleep disorders. These drugs enhance GABA activity, which can lead to memory. Okay, give me 1 second, guys. Gotta get paper. can lead to memory impairment and cognitive decline over time. Okay, proton pump inhibitors, or PPIs, commonly prescribed for acid reflux. Long-term use has been linked to increase of risk of dementia. Okay. All right, statins. While used to lower cholesterol, some studies suggest they may interfere with brain function and memory. Okay, then you have opioid painkillers. These drugs suppress pain signals, but can also impair memory and cognitive processing. Then you have beta blockers used for high blood pressure. They may interfere with norepinephrine and epinephrine, which are crucial for memory and focus. Get this straight around, folks. Okay, then you have dopamine analgesics, often prescribed for Parkinson's disease. These medications can cause confusion and memory issues. Different medications affect memory in distinct ways, depending on their mechanism or action and the neurotransmitter they influence. Here's a breakdown of how they differ. Anticoagulant drugs. These block acetylcholine, a neurotransmitter essential for memory and learning. Long-term use has been linked to cognitive decline and an increased risk of dementia. Okay, hold on. Be right with you, folks. Straighten this out. Okay, benzodiazepines used for anxiety and sleep disorders. They enhance GABA activity, which slows brain function. This can lead to short-term memory impairment and cause confusion, especially in older adults. Then you have proton pump inhibitors, or PPIs. While primary use for acid reflux, some studies suggest long-term use may contribute to dementia risk possibility by affecting nutrient absorption. Okay, then you have statins. These cholesterol-lowering drugs have mixed effects. Some studies suggest they may protect against dementia, while others indicate they could interfere with cognitive function. Okay. Give me 1 second. I'll be right with you, folks. Prescription drug medications linked to dementia. Opioid painkillers. These suppress pain signals, but also impair memory and cognitive processing, particularly with prolonged use. Okay, beta blockers used for high blood pressure. They may interfere with neuroepinephrine, and epinephrine, which are crucial for memory and focus. Dopamine agonists, often prescribed for Parkinson's disease. These medications can cause confusion and memory issues due to their effects on dopamine levels. Each of these medications impacts memory differently, and the severity of impairment often depends on dosage and duration of use. In individuals' susceptibility, if you are concerned about cognitive effects, discussing alternatives. Okay, each of these medications has a unique set of side effects, but here's a general comparison. Anticholinergic drugs. Common side effects include dry mouth, constipation, blurred vision, difficulty urinating, and confusion. Long-term use has been linked to cognitive decline and dementia. Benzodiazepines. These can cause drowsiness, dizziness, memory impairment, and depending on long-term use, may lead to intolerance and withdrawal symptoms. Okay, then you have proton pump inhibitors, or PPIs. While effective for acid reflux, PPIs have been associated with nutrient deficiencies. Increased fracture risk, kidney disease, and potential dementia risks. Okay, statins, while generally well tolerated, but some people experience muscle pain, liver enzyme elevation, and possible cognitive effects. Opioid painkillers. These can cause drowsiness, constipation, respiratory depression, and addiction. Long-term use, increased risk of dependence and overdose. Beta blockers. Effects may include fatigue, dizziness, slow heart rate, and depression. Some people experience cold extremities and sexual dysfunction. Okay, dopamine. Agonists used for Parkinson's disease. These can lead to nausea, dizziness. Hold on. I gotta get sheet. Hallucinations and impulse control disorders.